Hip dysplasia is a condition I see frequently in clinic, but it's often diagnosed late, sometimes years after symptoms first appeared. It predominantly affects younger women, and it's commonly mistaken for a muscle strain, a hip flexor problem, or simply normal hip pain in an active person. I'm Dr. Matthew Boyle, an orthopaedic surgeon based in Auckland. Hip dysplasia and hip preservation surgery are areas that I specialise in, and in this video I want to explain what the condition is, how it's diagnosed, and what treatment options are available. So what is hip dysplasia? Well, hip dysplasia means the hip socket, the acetabulum, is too shallow or poorly angled to properly cover and support the ball of the hip joint. As a result, the ball is not fully contained, and the forces through the joint are distributed unevenly. Over time, this causes damage to the labrum, the cartilage ring around the socket, and eventually to the joint surface itself. It's a structural problem that is present from birth or early development, but symptoms in adults typically emerge in the late teens or 20s, often in people who are physically active. So what are the symptoms? Well, the most common symptom is a deep aching pain in the groin, the front of the hip, that worsens with activity, prolonged sitting, or sustained standing. Many patients also describe a clicking or catching sensation in the hip and a feeling of instability, that the hip is going to give way. Because these symptoms overlap with many other conditions, dysplasia is often misdiagnosed initially. So how is it diagnosed? Well, diagnosis is made from a combination of clinical examination and X-ray. The key X-ray measurements, particularly the lateral center edge angle, which describes how far the socket covers the ball, allow us to quantify the degree of dysplasia. An MRI scan assesses the condition of the labrum and the cartilage. So what are the treatment options? Well, treatment depends on the severity of the dysplasia and the degree of joint damage present. For mild dysplasia, with no significant structural damage, physiotherapy focusing on hip strength and movement control can help manage symptoms, but it does not correct the underlying structure of the joint. For moderate to severe dysplasia, particularly in younger patients when the cartilage is still healthy, the gold standard surgical treatment is the periacetabular osteotomy, or a PAO. In this procedure, the socket is cut free from the pelvis, repositioned to provide better coverage of the ball, and fixed in the new position with screws. When performed at the right stage, before significant cartilage damage has occurred, the results are excellent, and the procedure preserves the native hip joint, avoiding or significantly delaying the need for a hip replacement. The window for hip preservation surgery, surgery that restores the joint rather than replacing it, is defined by the condition of the cartilage. Once significant arthritis is established, the options change. For a young person with undiagnosed hip dysplasia, early assessment is genuinely important. If you are a young, active person with persistent groin pain that hasn't settled with physiotherapy, ask your GP or physiotherapist for a referral. More information is available at matthewboyle.co.nz.